So this is a genetic disorder on the whole foot, and she also has them on her hands. And this is the one that's excruciatingly painful. So what we're going to do today is we're going to trim this one and get her back comfortable.
It's funny how this builds up, and it hurts all the time, even with that.
Yeah, I get it.
So I'm so thankful to come here and have you do this.
Yeah. And one way or another, after your grandson's wedding, we'll get it fixed. Because I'm sure this is probably interfering with your ability to be as active as you want.
Yeah.
Okay. And so you anchor your hand, and you just use these 3 fingers, and it's down and forward, or it's back and forward. You don't want to do chopping, you know. There are times where that's appropriate, but this works way better forward and down, or back and down. And I never use 10 blades for these. It's always 15 blades. They're smaller, you have better control. And you can see at the base of the callus there's a little bit of bleeding into it, which is typical with certain disease states or just age. Scared me.
Sorry.
It's okay. I just don't want to cut you.
No.
Okay. We can probably get a little bit more off right here. Now when there's like a circular type of area, you can circumscribe it with the tip of the blade. And this will allow you to go a little bit deeper. That didn't show it very well, but I'll show you on a different one. So where the yellow is, that's where that's callus tissue. Always shows up a translucent yellow. So we got most of this. There's still just some right there, and that's probably right where the pointy piece of bone is underneath this. So I'm trying to get a little bit more off of that. Now, one other thing I learned as a resident in surgery, the enemy of good is better. So this is good. And I think if I try and go deeper here, I'm going to hit blood. Okay, and then there was this spot right over here that was also quite painful. So let's trim that. Again, down and forward, or down and back. Just using these 3 fingers. Okay. Now I find it amazing that all the rest of these are not really painful when you walk on them. But okay, well, thank you for letting me videotape this, and we'll put this gel pad. This is a tube that has gel on the inside to help with friction and pressure, and we'll just keep that on to keep it growing slower, and we're good.